So far this week, we have concentrated on learning more about common developmental conditions and the types of impairments that children with developmental conditions may experience. Now, we will consider how developmental conditions and impairments contribute to a broader concept, developmental disability. We will begin by exploring common frameworks of disability in general, and then consider developmental disability specifically. Historically, disability has meant different things to different people and can be a tricky term to clearly define. A common way that people have thought about disability in the past was to use a medical approach. With the medical model, a child is seen as being disabled because they have something, and I quote, wrong with them due to a health condition. An example of this is describing all children with autism as disabled, or all children with a vision impairment as disabled. The primary concern with this approach is that children and adults with the same health condition may have very different experiences as to how this impacts on their lives. For example, consider two children with a severe hearing impairment. One child may receive speech and language therapy and assistive devices to support them, improving their ability to attend mainstream school, have friends, get a job, and so on. In contrast, another child with the same level of hearing impairment, who hasn't received these supports, may find it very challenging to learn in a mainstream school, and this will have lifelong impacts. In this way, the medical model doesn't recognise the role of the environment or external factors in excluding a child with a disability. In the next step, we will hear more about the social model, which was developed as a response to the medical model. The social model views disability as being due to society's failure to respond to the needs of children with an impairment. A child may have limited opportunities to attend and learn in school, not because of his or her impairment, but because the education system doesn't support his or her learning needs. This can include physical inaccessibility, no ramps or accessible toilets in school for children with physical impairments, learning materials not being available in a way that supports children with visual, hearing or intellectual impairments, or stigmatising attitudes of teachers or peers towards children with impairments. However, through a focus only on societal barriers, the model does not give enough attention to the role of the individual's impairment in their disability. For example, providing a ramp for a child in a wheelchair will not alleviate chronic pain that they might experience in their joints. Putting these different components together, a common way of viewing disability today is the International Classification of Functioning, Disability and Health, otherwise known as the ICF, and launched by the World Health Organization in 2001. Now, this may look overwhelming, but let's go through it together. According to the ICF, a health condition can lead to an impairment. For instance, meningitis can lead to hearing impairment. This can lead to functional limitations, for instance, difficulty in hearing, speaking, and communicating. These functional limitations can then restrict full participation in aspects of society like having friends or being able to go to school, and therefore result in exclusion and disability. This model therefore recognises three levels at which a child can experience a developmental disability. At the level of the body in terms of their health condition and impairments, at the level of the child in terms of functional limitations, and at the level of society in terms of the participation restrictions. The model also shows us that the impact of the impairment on disability is not inevitable, but influenced by different factors. For example, environmental factors, such as the access to assistive devices or rehabilitative therapies, and personal factors, such as wealth or social support. Here's another example. Autism spectrum disorder is a condition characterised by impairments in social functioning, communication, and behaviour. Impairments in attention function can make it difficult for children to focus their attention and make decisions. This can present challenges when trying to learn the skills needed to live independently. However, other factors, such as early intervention with an occupational therapist, or personal factors such as the child support network, can improve skills in attention function and decision-making, minimising participation restrictions. The ICF therefore combines aspects of the medical and social models and is the prevailing model for disability used globally that we will use when discussing developmental disability throughout this course.